Hey everybody, we're back here again with Dr. Ben. Last time we did a tour of his office and we got to see some of the things that he uses for treatment. And now we're actually gonna do a quick interview to see, kind of pick his mind and see how he treats patients. So hopefully we'll learn a lot. Hey Dr. Ben, so tell us about your treatment style.
So my treatment style is, I would say, more of a movement-based style. My goal is to get the patients moving.
Yeah.
As you know, motion is lotion, movement is life. Once you stop doing that, you start to kind of what we call stagnate or regress a little bit, and then eventually it leads to things like degeneration, osteoarthritis, these kind of long-term conditions that we usually see in the older population.
Okay.
So my goal is get them moving and grooving.
Great. And what is your philosophy when it comes to treatment?
So when it comes to treatment itself, like I said, it is about moving and grooving, but I try to assess where they're not moving well in first, and then try to connect, first of all, from the neurological side, the brain to the body connection, okay, and try to reinforce that. And then once that connection is established, and then we see if there's any actual structural issues, right? Like most of the time, I see a lot of more older population, so closer to the geriatric age. So those people, they tend to have already a little bit of degeneration, a little bit more obvious scoliosis. So I try to modify activities they do so that they can do the things they want to do without having aggravation or further complicating things.
Okay. So when it comes to like treating the geriatric population, do they come to you as if it's like, hey, I just really want to be able to like pick up my grandkids or something like that, like those activities where it's like, you know, I'm retired, not really trying to be too crazy with my body, but I actually want to do the things I want to do.
So that's a very good thing to point out too, because the geriatric population, you know, with them, they're not necessarily going to have the energy to do, like, especially with the young people, like the crazy workouts and whatnot, and then the things that a lot of like in the tech is targeting them with a lot of these gimmicks devices, right?
Right.
So I always ask my geriatric patients, number one, what is your goal? Okay, and then say, okay, what can we do to help you reach that goal? All right, and then so based on that, I present a treatment plan on how long it's going to take, and that's going to be based on, a lot of times after the first couple of visits, I'll get an idea how their body responds to that treatment. And from there, it's like, okay, this is what we need to do after you reach that point, right? You need to be able to maintain that.
Right.
And then from there, it's like, how often do they need to come in at that point, or when do they need to come in?
I see. And for those that don't know, geriatric refers to like the older population. And you know, what Dr. Ben is saying is like it's important to have movement and to have like restored movement and function for better health, especially for those who are older, because we do know inactivity leads to loss of muscle, weakness, imbalance, versus activity leads to stability, control, and strength. And that's kind of towards your philosophy, right?
Yes. Right. It's about balancing everything in your life, but maintaining that and being able to continue doing what you want to do or what you would like to do. If a lot of the older populations, by the time they have grandkids, they want to be able to interact with their grandkids too. Especially some of the newborn ones where they develop in that first year a lot of weight, and suddenly the grandparents are picking up all this weight, all of a sudden that's getting heavier and heavier by the week, right? Then it becomes a lot more difficult, and they have to throw their back out because they're not used to that load.
Right, yeah. And it's interesting because I recently saw a video about how to properly pick up a load. Is that something you go over with your patients as well? Like, okay, this is how you properly pick up your grandkid?
Yes.
Yeah.
There is kind of like a fundamental, basic kind of outline that all the patients should know when it comes to picking it up. But it's going to be based on dictated by their body structure and by body type and what their like capacity to move is at that point, and how they can do it without further aggravating themselves or potentially throwing their back out.
Gotcha. Yeah. I remember when I was working with you, you had a ton of certifications. What are some skills that you've picked up from those courses, seminars, or certifications that you feel like are impactful in your practice?
So probably the biggest one I've utilized so far was the SFMA. And so it's, in their scheme of things, they're talking about movement from a fundamental perspective. Like,
can you briefly go over what SFMA is?
So SFMA stands for Selective Functional Movement Assessments. So what they do is that they take you through a top screen, which is like some basic fundamental movements that you should be able to do, like neck flexion, extension, rotation, bending over, touching your toes, extending backwards, and rotating through that. And they assess that on like a basic skill. If you pass all that, that's when they kind of take you up to the next level, which is the FMS.
Yeah.
Right. And so you usually see FMS more for like active populations or athletes and all that stuff. That's the next level. Below that is just like the average population, which should be the SFMA. It's like, can you even hit this baseline? If not, all right, how far down are you to finishing that baseline? And then what I loved about it is the breakouts for that. So like, okay, I do the top screen, right? And then I go over, okay, where is it not functioning properly? And then I kind of assess that area. Okay, is it an actually joint issue? Is it a fixation issue? Is it actually muscle issue? All right, or neurological issue? And then we address that and we work on that. Okay. The other thing I also I'm certified in that I use a lot is the FRC, or the functional range conditioning.
Okay.
Most of the time, people don't know how to articulate, or they lost the connection from their brain to whatever joint they want to utilize, right? So what I loved about the FRC was, okay, how do I get them to stabilize that joint and actually build that connection back, reconnect the brain to the body? From there, how do I get them incorporate that as part of their daily routine and their daily movement patterns, so they strengthen that.
Okay. And do you use like SFMA or FRC as more of a screening tool, or is it kind of a diagnostic tool as well?
SFMA more of a screening tool, and then that screening tool allows me to kind of dictate, okay, where do I go from here? Okay, so it's like, is it more of this condition versus this condition versus that condition? All right, and you learn about those conditions in school, and so you know, like, okay, for this condition, I need to be able to do X, Y, Z, all that stuff, right? And then for this condition, it's this other set of things. So that's where you kind of had to know your background in differential diagnosis and understand, like, oh, where is this issue coming from? Okay. And then when it comes to the FR, I use it more as like kind of like a rehab type of thing, FRC stuff.
Okay, yeah.
So it's just like, can you even control your movements?
Right.
Because if we look at from an injury perspective, when do we usually injure ourselves? It's usually when we overload one range of motion, right? Or we move in the range of motion that we're not used to.
Right.
All right. Like some people are like, oh, I haven't reached back into the car to grab something from the back of the seat, and suddenly, oh, the back goes out.
Right.
That type of stuff. So I use that as a baseline to, okay, this is where your movement should be. Okay, let's train your body to be comfortable in these end ranges, where at the maximum ranges you can your rotation, your reaching, all that stuff, right? Right. So once your body's comfortable with that, it'll allow you to go towards that route without an issue. It's not going to like suddenly freeze on you, like, oh, this is something new, I'm going to guard against it.
Okay. Yeah. Right? Great.
Does that make sense?
Yeah, definitely. Going on along the lines of like certification seminars and whatnot. I know chiropractors have to complete a certain amount of continuing education every year. Yep. Can you shed some light on how that works?
Yes, I think it was 24 hours or units of CEs per year annually. And so right now, I think they're back, at least in California, they're back to half of it in person, half of it is online.
Okay.
During the whole pandemic, they allowed everything to be online, at least during that time. But now, since we're seeing things return to normal, they're starting to bring back the half in person, half in online type of stuff.
Okay. And do you have like specific CEs that you like to attend that you feel is helpful?
There are so many options out there. One of the ones I'd like to participate in is the Parker seminars, just because I could get half my CEs done in there, but it's also in person, allows me to kind of travel, meet other chiros from different backgrounds. Right. And then what I enjoyed most is actually exchanging like kind of case studies or like stories. Okay, those are what sticks with patients. It's like, oh, the story of this person's condition during X, Y, Z, and I found like, oh, this is helpful, and then you learn more from that. Versus, yes, there's a clinical aspect to it, but most people just kind of tune out that because it's just kind of the boring clinical stuff that doesn't that you're kind of
unless you're like super into the research and want to know and like keep up to date with it.
Yeah, I would say the vast majority of the chiropractors who are actually practicing actually want to do more of the treatment side of things, and they don't want to deal with all the research and that kind of aspect. So that they kind of tend to lean into that. That's what you see with a lot, especially the young chiros. The older ones start to like delve a little more into the research and things to kind of support them, support what they're doing and stuff. So it's like, okay, it depends on where you are in your journey. So it's
the Parker seminar happens like once a year, right? That's the one in Vegas.
There's actually, it happens I think twice a year. Once I have to look back into it again, but yes, they have an annual one in Vegas.
Yeah.
Usually in like end of February, but they also have another one like later in the year. I think summer or late summer in I think the East Coast. I believe it's Florida.
Oh, okay.
Yeah.
Yeah.
So they do that. They have one thing for each year, right?
Yeah,
They
yeah.
do like at least 2 seminars.
Yeah.
Annually, and then they have different guest speakers.
Right.
Okay,
Right.
and then they have different keynote speakers. All right.
Yeah.
So and then what they're trying to do is kind of bring to light, share different perspective from other
Mhm.
healthcare professions, and then they're trying to integrate that with, all right, chiropractic as well.
Right.
So some of the guest speakers are MDs or people who are studying, or neuroscientists. Other things are more specialized out of healthcares.
Yeah.
And they're trying to educate what's new, up and coming.
Yeah.
Okay, and how they can be integrated in holistic care.
Mhm.
All right, and you'd be surprised the amount of people who are more like a lot of MDs who are trying to look into more conservative treatments or holistic treatments
Right.
versus like medications.
Yeah.
Right, because the evidence is out there showing like, okay, medications is not always the way to go.
Yeah.
It's great for emergency purposes or life-saving
At
purposes.
least not like the first step.
Yeah.
To take.
It also comes down to the patient's background and history too.
Right.
So, but ideally, okay, let's take a conservative approach of things. What can we do that's like non-invasive, and think, or what can we change so the patient actually feels better?
Yeah.
Because in the end, it's all about how is the patient doing on the subjective side of things and the objective side of things.
Right.
Okay.
Yeah. I know one of the guest speakers in the most recent seminar, or the Parker seminar, was Tim Tebow. So how did like Tim Tebow relate whatever he was talking about to chiropractic?
Oh damn, he said a lot of things during that speech, but a lot of it. Well, when it comes to chiropractic, he was talking about how it helped him maintain and stay in the game when he was still playing.
Yeah.
And then, but his speech specifically was talking more about how can you help the next person, okay? And then how do you inspire? And so it was there was an overlap with his a little bit and the other guest speaker, which was Ed Milet, I believe. Yeah. So there was some kind of overlapping in there. And then, it's even though it's been like a month and a half, I still can't remember every single little detail. I'm so sorry. Because there was a lot of things you learned there, and then some of them stick, some of them like, oh, geez, there's so much information.
Because I know they typically have those speakers like the Tim Tebows and Milets as more of like an inspirational aspect.
Yeah.
To get you like fired up.
Yeah.
I'm just wondering if there was also a way that they turned it towards like, oh, this is related to chiropractic.
Yeah. I think for a lot of those speakers, what they talked about, what they loved about chiropractic was the ability of the chiropractors to actually really listen to the patient. It's not like you go to the doctor's office, right, and then you actually see the doctor's assistant first, and the doctor comes in for about 5-10 minutes, and this is registration, blah blah, and they're out the door, right?
Right.
But whereas most of the chiropractors, they're at least sitting down and present with the patients, especially the ones that are really good at their jobs. They are listening and tuning into what the patient wants and needs and addressing that and tying how the treatment is to what their goals are.
Right.
Which is, I think, a lot of the mainstream, sometimes there is that lack of communication. Yeah. And then, so you see a lot of them now are trying to kind of back off a little bit and try to doing that approach, more holistic and I guess empathetic approach would be the best term. Yeah. Because a lot of times there's that disconnect, and now we're trying to reconnect everything again.
And I think with chiropractors, like not only are you able to build a relationship with the patients in terms of listening and talking, but you also have this hands-on aspect of chiropractic. Yeah, that really helps with, okay, I'm actually feeling what you're talking about. You know, so I think that's important in that patient-doctor relationship.
Yes. Okay. And then so a lot of times on that aspect, like for example, when I'm observing and examining the patients during the initial visit, right? Of course, it's hands-on. I'm doing measurements, right? I'm palpating, right? I'm feeling things around, and I say like, okay, is this area where you're feeling it? It's like, and then kind of reinforce that, okay? And I tell them, I kind of do a little basic education because that's the other aspect of healthcare that people are not really addressing. Is that how is their condition or symptoms presented into their discomfort and pain, right? Right. So I ask them, okay, is this hurting or is it not hurting? Is it make it worse, make it better? Each of those little exams I do. And then I kind of do a little brief education of like, okay, what this means, again, how it ties into XYZ, right?
Yeah.
Right, like, oh, I have a mid back issue, big back discomfort, but it's actually coming from the neck, vice versa. If there's a neck issue, but you're feeling it in the back. So it's like chicken or the egg, right?
Right.
Working first.
Yeah.
Yeah. So you're kind of chasing that at the same time you're trying to alleviate the patient because they're like, okay, this is what this is, all right, and this is how we're going to approach it.
Okay.
Yeah.
So let's loop back in for our last question to actually when you're treating your patients, and it's a lot of times a geriatric population. One of the things that I try to demystify is like they throw around a lot of medical terms.
Yeah.
And they'll come in like, I think I have this, I think I have piriformis, whatever. So let's talk about kyphosis. Kyphosis kind of means like, well, we're talking about most specifically hyperkyphosis, like that C shape in the spine when you're seeing a lot of times when people get older, they're starting to look like
hunchback.
this. Yeah.
Okay.
So what exactly does that mean, and how do you treat a patient that has like an increased kyphosis?
Okay. So it's like my first visit, I tell them like, okay, that's kind of a normal thing to see among the older population because that's part of the aging process, the increased kyphosis. But why does that occur in the first place is what I try to drill home with the patient. Okay. So it's like, okay, this is typically because from a physics standpoint, gravity is impacting the body, right? So it's going to be pulling you down.
Right.
That's one part of the equation. The other part is what is their activity? What have they spent their lifetime doing? Again, most of the time, especially nowadays, especially with the advent of all these computers, laptops, smartphones, what's most of the population doing?
We're kind of looking like this.
Looking down on the phone, right? And so, as we know, the more force we're looking down, the more the gravity impacts on that head, and that's going to pull things more forward.
Yeah.
And then body is going to try to be trying to be adaptive and efficient to that type of stimuli, and it'll adapt as best as it can until you hit a threshold.
Yeah.
Once you hit that threshold, that's like when the pain and the discomfort starts to set in, and that's when you start to seek some care, right?
Right.
And then, but it's like I tell patients, like, okay, what you have is something that's been building up over time. This is going to take some time to kind of make you feel a little bit better.
Yeah.
You might feel some changes here and there, but most of the changes what you see is, at least on the physical side, the objective side, it does not seem like that much. But did the patient feel better? Is there less symptoms?
Yeah.
All right. Are they able to do what they need to do?
Yeah. Right.
If yes, it's like, okay, that's a good. To me, that's a good treatment. All right.
Yeah.
That's a good treatment plan. That's a good, let's say, prognosis of whatever the condition it came in too.
Yeah.
All right. Do I expect it to be like 100 back straight? No. At that point, there's structural changes that you can't really reverse at that point outside of like doing more invasive surgery.
Just natural age and degeneration over time.
And degeneration is kind of a natural process just because the gravity is always pushing on us up.
Right.
But what we can control is how fast, we degenerate and how much. Yeah. And that's typically, it has to do with the physical activity levels that most of the older population is lacking. Because as we get older, we tend to get a little more complacent about things, right? And then we tend to like, okay, that's too much of a handful, and I'm not going to do that or that stuff. And they just kind of, I don't want to do this, I don't want to do that. They get a little, I guess, comfortable. Oh, not necessarily discouraged, just like comfortable with what they have already. Yeah. And they don't want to spend any more effort than needed. Right. So what I found especially within the last 2-3 years, is it's just about talking to them with them as a person, right? Most of the time they want someone that they can talk to and listen to, and then just kind of changing their mindset a little bit, take a different approach of things. Smaller changes here and there that make a big difference. And that is probably the most difficult part of being a chiropractor or being a healthcare professional, is being able to communicate with the patient. Right, yeah. Well, I mean, keep doing the good work. You're doing great. All right, thanks a lot, though. All right, thanks for having me in, Dr. Ben. All right, no problems. Anytime. Thank you.